Hello and welcome to Moto Mental Health. Again, my name is Mark Ali Bishop, and I want to thank you for riding with me on our journey to emotional wellness. Today's video is going to cover a couple different topics. The first part of the video is going to tell you a little bit about who I am, a little bit about my education and my credentials, because you should always know who you're getting your information from. So just like if you have a really good friend who learned how to change his motor oil by his dad, doesn't mean he's qualified to work on your transmission. And you may know someone who might have taken a splinter out of your finger, but you may not want them doing any kind of major surgery on you. So you always want to make sure you know where you're getting your information from, and you want to make sure that you're getting it from a qualified professional. The second part of the video is going to be the title and topic of this video. It's Therapy, Is It For Me? Now, first of all, I want to do a little disclaimer that these videos are in no way a substitute for any kind of mental health services or therapy, okay? These are just educational, informational videos that I am hoping that will help you on your road to emotional wellness. So, first of all, about me, a little bit about my background. I am a mental health therapist. I am now working in a public high school, and I'm actually doing individual mental health therapy at our school, and I have a pretty large caseload of about 35 students, and then also I run some groups during the year, and right now I'm kind of putting together a grief and loss group. And so I do quite a bit at the high school, individual therapy, but also I do crisis intervention, with some restorative justice work, and a lot of risk assessments for our children who are feel that they're a danger to themselves or a danger to others. So to start off, I got my bachelor's in clinical social work with an emphasis on community mental health. I got that at a state university in California, and then I went on and did my master's, and I got my master's in clinical social work with also an emphasis on community mental health. Now I'm actually in the field. I'm finishing up my hours to actually take my state license exams. I'm very close to having my hours complete and finished, and to get my license in clinical social work. So right now I'm an associate clinical social worker. And another disclaimer here, I am not attempting to make any sort of profit on these videos. These videos, the sole intention is that I can reach many more people than I actually do. There's so many families that I have worked with that have asked me if I can work with multiple members of their family, husbands and wives and things like that. Unfortunately, I'm not in private practice, and so I'm very limited as far as the amount of people or individuals that I can work with or help. So I'm hoping that these videos can be a start to reach a wider audience. And so that is the purpose for these videos. I have a career, I have a salary, I have a full-time income. I am not doing these videos to make money. I will not be pushing any kind of products. I will not be doing those commercial type things that you might see in other videos. I'm not making t-shirts, trying to sell any kind of thing like that. Any revenue that I might make from YouTube ads or anything like that is going to go strictly back into the video production. I am very new at this. I am a new YouTuber. We have some phenomenal YouTubers, creators out there. And when you watch their videos, and I've watched many, they're just phenomenal. The editing, the cinematography, just everything in these videos are just they capture you. But I'm a new YouTuber, so please be patient. I've only done a handful of videos, a couple I've only published. I've done a couple videos for my family. So I'm new at editing. You're not going to see the flash. You're not going to see all that, just crazy animation stuff in my videos, at least in the very beginning, just because, I don't know about editing, and this is a new field for me, but What I am going to do attempt to give you content and substance over all that flash and glamour. So, so those are my motivations for doing these videos. A little bit about populations and the field that I have been in. I started out working in the drug and addiction centers, drug and alcohol addiction centers in the Sacramento area. And I actually started there just because of my family. Unfortunately, my family had a lot of dysfunction as far as drugs and alcohol. Both of my parents were alcoholics my entire childhood, all the way into my young adulthood. Thank goodness they were able to get themselves together and sober, and at the end of their life, they were, very sober and very happy. But with two alcoholic parents, there's a lot of dysfunction in the home. Some older siblings of mine struggled with alcohol and/or drug abuse, and so again, with them in and out of the home, there was a lot of dysfunction. And so I am a child prodigy or product of dysfunctional drug and alcohol addicted family. And so I understand the inner struggle and turmoil of those who are struggling with the addictions, but also too with those who are directly affected with individuals in the family who are addicted. So I started there, and then I wanted to be a well-rounded therapist. And so what I did is I started to think outside and started thinking about how can I be a better social worker, clinical therapist. I started working with a really good agency out of Sacramento, California, called Turning Point. I was working with the homeless population. They were doing complete wraparound services for individuals who are attempting to get stable and safe housing. And so I was actually doing the clinical part of working with those individuals. And a lot of my work is around dual diagnosis, where you're looking at two different mental health aspects. So the drug and alcohol addiction is one, and then there might be another one. It could be schizophrenia, it could be bipolar, it could be depression, it could be anxiety. So you're looking at multiple mental health issues with individuals. And so I did that for some time, and then thinking about my profession and just kind of bettering myself and my skills, I wanted to kind of start working with the youth. I volunteered with the Sacramento Sheriff's Department, and I was actually kind of a ride-along social worker. And it was a program that they had started where they were trying to outreach to the community within Sacramento. So the Sheriff's Department was taking uniformed officers, bringing them into the schools, but also too they wanted to be very careful because of the stigma behind police officers in the community. And so they wanted someone like me to assist the officer, and so I actually did that for quite some time, a little over a year, and really enjoyed that work. And being inside the schools and visiting the schools with the officers, I knew that was a population I definitely wanted to be a part of and kind of work in. So I actually I started working at an elementary school in Northern California. Absolutely did phenomenal work. I had great clinical supervision. I just learned so much, and I realized that was the population I wanted to work with. So I did a lot of individual work with some of my students from second grade all the way to sixth grade. So we're looking at from 7 to about 12 years old. And so yeah, that was great. And then being in the school system, I felt I had a greater chance to make a greater impact for children. And so then I started thinking a little bit more about working with the older students. So I was thinking junior high school. I had an opportunity to work in one of my local high schools, and I absolutely loved it. I have been there for, I think this is my 4th year now. And so now I'm working in the high school population, and I think it's extremely important because now I'm working with young students who are making a very important transition from young adulthood to adulthood. And these students, they're going through an array of issues, again, with anxiety, depression, addiction. There's a lot of grief and loss. A lot of my students have lost parents or siblings or loved ones and just trying to adjust. And so I'm so happy to be able to be there and kind of help them through as they enter adulthood. I have a strong caseload, about 35 that I see weekly, and then I also do groups as well around an array of different topics. So that's a little bit about me, my education, and my background, different populations that I've worked with. So let's get right into the topic of today's video, which is therapy. Is it for me? Now, forgive me, I have some notes. I want to make sure that I kind of stay on topic, so I'm just going to glance down every once in a while. And so when it comes to therapy, we want to make sure that we know what mental health is. So mental health is how we think, how we feel, and how we act towards others, right? So if these are unhealthy in how we feel, how we act, and how we feel towards ourselves and others, then we can start thinking about if therapy is for me. Now, with therapy, with mental health, let's just talk about mental health for just a moment. We have two types of health, right? So we have our physical health, and then we have our mental health. So if your physical health is down, you're going to address what it is that's causing your physical health to go down. It's the same thing with mental health. So our mental health is on a continuum. From the time we're born to the time we die, it's going to be up. It's going to fluctuate. It's going to up. It's going to be down. We're going to have high moments. We're going to have low moments. So our mental health is a continuum. Now, there is mental illness, right? And so if your mental health is severe enough to the point where it's extremely impacting you negatively, then we can talk about mental illness. But overall, our mental health, we want to stabilize just like our physical health. So some of the things that we want to look at as if, I'm thinking about therapy and is it for me? If you're finding that you're having a lot of emotional lows for absolutely no reason, you're sad all the time, there's no reason to be sad, or at least you don't feel there's any reason to be sad, or you're angry all the time, you're just flying off the handle for no reason at all, right? You're just having these emotional outbursts. Then we can start thinking about, what is therapy for me, right? Also, too, if you're having consistent negative thoughts about yourself, about your environment, about other people, that's, and you just can't shake these thoughts, and these are going on for a long time, then we can start thinking about if therapy is for you. Slipping back into old unhealthy habits, that's, I work with, in my student population, a lot of individuals who have had some addictions of some sort or another, and they're struggling with those addictions, and they get clean, and they stop seeing me for a while, and then they kind of slip back into old behaviors. Well, then we can start thinking about if we want to reintroduce therapy, or even just start therapy because maybe they haven't started yet. So slipping back into old behaviors, and then not being in control of your emotions. That's another key sign that, I would like to have a discussion. Let's just kind of start thinking about whether therapy is for you. You have to figure this one out for yourself. So therapy is something that I truly feel, doing this for quite some time, as long as I've been doing it, that has to be a personal choice. It can't be forced upon you. There's so many people that I've worked with who it's their parents that are making them do it. It's their spouse making them do it. But the thing of it is, and forgive me, the wind's kind of picking up here a little bit, and I'm hoping that it'll die down. And I'm hoping it doesn't affect the audio. Forgive me if it does. But the thing of it is, it should be a choice. It should be your choice. And I've seen resistant clients come in, and they're completely not willing to do it. It's just other people in their lives that are expecting them to do it to get the help that they need, but they're just not ready for it. And I will tell you that it is going to be a long, long journey, much longer than it needs to be, just because that person is not either willing or able to go through therapy. Also, too, there's two types of therapy. There's legally mandated and there's volunteer therapy. Legally mandated, working in the drug and alcohol addiction centers that I worked with, a lot of individuals that I did work with were court mandated to be in counseling or therapy. Just based off of a negative event that they experienced, DWI, DUI. The judge said, you know what, maybe this is your first offense. If you go seek therapy and treatment, then we'll either reduce the fine, reduce the jail time, or suspend the fine or suspend the jail time. And a lot of course, you're gonna, someone who's get caught up in the legal system, they will want to do this, but they don't necessarily are into it, and so they kind of fake it till they make it, right? They just do the time, and then they get done with it and they move on, but they don't really get any benefit out of it just because mentally they're just not into it. So yeah, and then like with domestic violence, I've worked with some families where there's been some domestic violence in the home, and maybe it's the husband or even the wife that is court ordered or court mandated to seek treatment and for anger management, say, and they're doing it only because the judge told them to, and there's a lot of denial, a lot of minimization, and they're just not into it. And again, they're just faking it till they make it, and they're just doing what the judge is asking them to do, but they're completely not into it. So the best results are when you're really into it. It's your choice. It's something you want to do, not something you're doing for other people. How long does it take? Well, that actually is between you and your therapist, right? So when you start building this relationship between you and your therapist, you guys are going to have this discussion. Now, in the very beginning, you're going to be, when you first meet your therapist, you're probably going to do an assessment of some sort. You're going to be filling out all these questionnaires so the therapist gets a better idea and better understanding of your history, mentally and emotionally and physically. And then also, too, you guys will start having this discussion. You'll set up a treatment plan based on the questionnaire and the interview that you've had with your therapist. Then, you'll start having that discussion of how long it'll be. You'll set up some treatment goals. And then therapy should not be forever. Now, everyone's different. And so everyone's issues are different. And with that, some therapy could be short-term therapy. I've worked with students, I've worked with adults, I've worked with children, 4 weeks, sometimes 6 weeks, 8 weeks, 12 weeks, a year. Some people go through therapy for multiple years just because of a lot of things that they've been going through and struggling with. So everyone's different. It kind of goes by case. And so let's see here. A couple things I wanted to talk about. I want you to think about also too, when you get into therapy, of choosing your therapist. Yeah, you have the right to choose the therapist that you work with. Okay, it may take 2, 3, 4, 5 different therapists till you get the one that's the right fit for you. There's a lot of variables that go into this as well. The age of the therapist, the gender of the therapist, the ethnicity of the therapist. So all of these things play a role in how successful the therapy will be. I encourage all the students that I work with who wind up getting outside providers, which is fantastic when they do, to make sure that they are clicking with their therapist. And I actually had one student that said, my therapist, my psychiatrist, she was seeing a psychiatrist, fell asleep during my sessions. And I told her, I said, let's have a discussion with mom about getting you a new psychiatrist or a new, someone else, because that is not okay. So I want you to know that if you are struggling with your therapist and you're finding that you're just not getting the help that you need, you actually have a choice for change. And so I want you to be open and honest with your therapist. And I've actually had my students do that with me. I had one, we did extremely good work around the loss of her father. But my clinical supervisor told me that she felt the student was moving too fast and that our sessions would come to an abrupt end just because I didn't pace out my sessions as well as I should have, and the student over disclosed too much of a time. And sure enough, my clinical supervisor was absolutely correct. But my student was strong enough, had enough self-esteem, enough strength in her to ask me if there was anyone else that she can speak with. And there's a whole host of reasons behind that of why this happens, but long story short, we actually had a female therapist that was actually a really good fit for that student who went on to work with this female therapist for 2 more years. And so yeah, I got her the emotional support that she needed. So absolutely. So the next question that I get is, where do I start? How do I even start, finding a therapist? The first thing we want to do is, I would encourage you to talk to your primary care physician. Whenever I start with any of my clients, we always want to rule out the medical. So that is actually a really good place to start. I actually had a incoming freshman a couple years ago, and mom reached out to the school and said, my daughter's depressed. She has all these indicators of depression, and I want her to work with someone around depression. So working with this student and never have met this student, there was absolutely some big red flags, some indicators that were telling me that this child might be depressed. But I know with my training and my background, we gotta rule out the medical. So I encouraged mom. I said, you know what? When's the last time this child's seen her doctor? Let's get her a physical. Let's talk to the doctor about depression and things like that. Well, the indicators came up. Unmotivated. She had some attention focus issues, low energy, a lot of irritability, some anxiety, a lot of nervous stomach issues. After the doctor did a battery of tests, it came back that she had diabetes, she has hypoglycemia. And so there was a low blood sugar issue with this child. And so they went through the medical treatments of getting her blood sugar back up, changed some things in her diet. And long story short, she didn't need to work with a mental health therapist. Her mood came up, her energy came up, her attitude changed. There was such a drastic change in this child that mom was like, oh my God, I thought she had depression, when we're really looking at a physical health issue. So the first thing I would want you and encourage you to do is start with your primary care physician. Now, if you're young and you're watching this video and you're thinking, well, I want to have this conversation, but I don't want my parents to be there, tell your doctor. Say, is there any way I can talk to you without my mom and dad there? And parents out there, you don't need to helicopter and hover over your child when you're dealing with professional help. Let your child talk and work with the doctor or their mental health therapist. So yeah, trust the process. So, and then another one is your insurance. I would highly encourage you to look at your insurance. Now, here's a caveat to the insurance thing. If some mental health therapists, they actually do insurance, they do take insurance, that's great, because if you have insurance, that's phenomenal, right? So there's no out of pocket cost. The problem with this, and we find this within therapists out there in the community, we have this conversation, that we have to let everyone know that if you're going to go through your insurance, all the insurances are asking for diagnosis. And that's fine if you actually have a true mental health diagnosis. But if you're just kind of dealing with depression and you're not depressed and you have to be diagnosed with depression for insurance to pay for it, that goes on your medical record, okay? So I actually had a student that was worried about this, and he was battling some depression issues. There was a lot going on in his family, but he wanted to go to the Marines. And so working with this student, he told me, he said, you know what, are you going to diagnose me medically? And it was a really good question he had. with anything, because I want to go into the Marines, and if they find on my medical record that there's a mental health diagnosis, I may not be accepted. And so I told them, I said, hey, you know what, let's before we even start talking diagnosis, let's just talk about ruling out some of the stress in your life, and is kind of work on those things first. I worked with this young man for over a year, and we worked on a lot of things, and he started feeling better, and there was no diagnosis for depression. We worked on some things that were making him feel depressed, but we didn't have to diagnose him with depression. He wound up finishing his work with me. He wound up graduating. He wound up going into the Marines, finishing boot camp, and he's actually come back and visited. He's doing really well emotionally and mentally. So those are some of the things just around therapy, just a kind of introduction to therapy. There's probably a lot more questions. If you have any questions at all, you can leave me a comment below, and I will answer that comment. But also too, you can email me personally. If you want to email me, you can just go to motomentalhealth@gmail.com. So motomentalhealth@gmail.com. You can please feel free to send me any kind of questions or any kind of comments or any feedback that you may have, and I will do my best to get back to you as soon as I can. If you have found this video helpful, please leave me a comment. Please leave me some feedback. Let me know how to make this better, but also too, let me know what I'm doing right. When it comes to mental health, I have to worry about my own mental health. And when you get positive comments, you know, you're being more motivated to do things that you do. So it's the same for me. So if you give me a positive comment, it's just going to put more fuel to my fire. And so it'll help me to do this a little bit more. Also too, please share this video for anyone that you may feel that can use it. It might help them, might benefit them. Because look, there's only so much work we can do out there, and we want to touch as many people as possible. So please share this video, like, subscribe, that would be awesome. And then I would just want to thank you for your attention, your engagement, and we'll just take this journey 1 mile at a time, just like I said. I want to thank you for being with me on this journey to emotional wellness. Please be kind to yourself. You absolutely deserve it.